What are blast cells, and what do they mean for leukemia? Imagine your blood as a busy city with different types of workers doing important jobs. Among these workers are immature cells called blast cells. Normally, these blast cells develop in the bone marrow, which is like a factory for blood cells. They start out as young, undeveloped cells and then mature into fully functioning blood cells like red blood cells that carry oxygen, white blood cells that fight infections, or platelets that help your blood clot. In healthy people, blast cells make up less than 5% of the cells in the bone marrow and are rarely seen in the bloodstream. Their main role is to serve as the starting point for creating mature blood cells. Now, when it comes to leukemia, things get a lot more complicated. Leukemia is a type of blood cancer that begins in the bone marrow. Instead of developing normally, blast cells start to multiply uncontrollably. They become abnormal and fail to mature into healthy blood cells. This abnormal growth causes a buildup of immature blast cells in the bone marrow and often spills over into the bloodstream. When blast cells make up 20% or more of the cells in the bone marrow or blood, doctors consider this a key sign of acute leukemia, like acute myeloid leukemia or acute lymphoblastic leukemia. Having too many blast cells in leukemia has serious effects. Because these immature cells crowd out healthy blood cells, the body struggles to produce enough red blood cells, white blood cells, and platelets. This can lead to symptoms like fatigue from anemia, increased infections because of a lack of mature white blood cells, and easy bruising or bleeding due to low platelet counts. The rapid growth of blast cells also signals aggressive disease, especially in acute leukemia, and if untreated, it can cause the bone marrow to fail completely. In chronic forms of leukemia, blast cells may initially be fewer, but they can increase over time, making the disease more severe. Measuring how many blast cells are present is crucial for diagnosing leukemia. Doctors take samples of bone marrow or blood to see how many blast cells are there. This helps determine the type of leukemia and guides treatment options. Treatments aim to reduce or eliminate these abnormal blast cells and restore normal blood production. Common approaches include chemotherapy, which uses powerful drugs to kill the cancer cells, and sometimes stem cell transplants to replace the damaged marrow. In summary, blast cells are immature blood cells that, when they grow out of control, are at the heart of leukemia. Their excessive presence disrupts normal blood cell production, leading to the symptoms and health risks associated with the disease. Understanding blast cells helps doctors diagnose leukemia early and decide on the best treatment plan. If you or someone you know is concerned about leukemia, it's important to consult healthcare professionals for personalized advice and care.